Won't forget that picture anytime soon, will you? Okay, so what's the prognosis for Kate's acute morning sickness? We are here with Dr. Paul Wilkes. He's been on the show before. He's going to explain what hyperemesis is and whether or not it means twins. How you doing, Doc?
I'm good. Thank you for having me.
Absolutely. Okay, let's talk about this because, you know, back in the day when women had this type of sickness, it's morning sickness, you're pregnant, you move on, you just deal with it.
Well, there's a distinct difference between morning sickness and hyperemesis gravidarum. Okay. So morning sickness tends to be that normal nausea and vomiting that women get in pregnancy throughout the first trimester. Mostly nausea, not so much vomiting. Hyperemesis is when you're actually vomiting, and sometimes up to 12 to 14 times a day. Results in dehydration, can be dangerous for the mom's health and obviously dangerous for the baby's health. So there's that distinction.
Okay, so once you realize that you have this, what is the first step? Because obviously you're not going to go to the hospital because everybody's saying it's just morning sickness.
Right.
At what point do you say, okay, enough?
So we get this question a lot over at Desert Perinatal Associates where I practice.
Okay.
And, you know, it really has to do with, and, you know, it's not the most scientific way to decide if you're dehydrated, but I tell moms after you pee, look at it.
Okay.
If it's clear or light yellow, you're okay. You're well hydrated, even if you don't feel so great.
Right.
If you start to see that urine get concentrated, dark yellow, you start to get headaches, then you're really getting into serious dehydration. And there seems to be a tipping point where once you get to a certain point of dehydration, your body just won't accept fluids by mouth. Okay. That's when you need to get rehydrated by IVs. Okay,
there you go. Now, does age play a part? Does it make any difference? Like, if Kate, obviously very young there.
Yes.
But say if it's a woman in her 30s or maybe even early 40s, we hear about, you know, mothers having babies that late. Does it make a difference with the morning sickness?
So the risk factors for hyperemesis gravidarum, that is the severe morning sickness, are things like multiple pregnancies, twins or triplets. Okay. There's a subset of dangerous pregnancy called a molar pregnancy, which is really a placental tumor. High incidence of hyperemesis. Yeah. Age, not so much, with the exception that if you look at moms who are in high-stress situations, there is a higher incidence of hyperemesis. So imagine the princess, she gets pregnant. She knows the world is going to be focused on her.
There you go.
Automatically, that anxiety kicks in and increases her risk.
There's the answer right there. See, the world is watching her. She can't help but to have anxiety about this.
Right, and so much pressure. I mean, you're talking about the heir to the throne.
Yeah. Oh my goodness. Okay, so how long can you expect to deal with something like this, and is there any type of treatment for it?
There are lots of treatments, yes. So, so hyperemesis tends to be from about 15 weeks from conception to 15 weeks, but there are severe cases where women deal with it throughout their entire pregnancies. We look at dietary modifications. Have a small snack in the morning before you get up, before you even consider lifting your head off the table or brushing your teeth. Even something like saltine crackers and a sip of 7-Up. Then there are some easier things. Vitamin B6. Ginger tablets, frequent small meals throughout the day as opposed to breakfast, lunch, and dinner. There are medications that are effective, even over the counter, Dramamine, Benadryl.
You can take that while you're pregnant?
Yes, those have been shown to be helpful for hyperemesis. And in the more severe cases, we use prescription medications, and some women throughout their entire pregnancies have to get all of their nutrition through an IV.
I can't even imagine going through that for 9 months.
It's, you know, the moms who go through it, they demonstrate amazing strength.
Of course,
But the important thing is recognition, not sitting at home and getting behind the 8 ball and getting so dehydrated that we're playing catch up.
Okay. Dr. Paul Wilkes, Desert Perinatal, great job. Thank you.
Yeah, thank you for having me.
Absolutely, because everybody is wondering about this. All right, Jason, back to you.
Okay, thanks, Monica.